Having dwelt so much on the definition of diabetes, the types of diabetes and the causes of diabetes, we will be going now to prevention and complication of diabetes. So we are going back to our chief dietitian to talk to us. How can diabetes be prevented?
Thank you, the moderator. Simply put it this way. If you are the type that consume a lot of refined sugars, we'll talk about that more when we go to the dietary aspects. But if you are the type that's almost simple refined sugars, you are consistent consumption of simple refined sugar, please, my brother or sister, we are going to the diabetes. Please just kind move.
Okay.
Now let me go to complications of diabetes. Complications of diabetes. We have short-term complications and we have long-term. I will start with the short-term complications and explain to you. Things like hyperglycemia, hypoglycemia, and diabetic ketoacidosis.
Okay.
These are so many, but in time, on our side, we just want to explain this thing as short-term complications. What I mean by short-term is that once you have diabetes, in a question of maybe months, if you're not careful, you don't manage it very well, both with your diet and you start having this that is so-called short-term. Hyperglycemia, hypoglycemia, and what? Diabetic ketoacidosis. Now, what is hyperglycemia? Simply put it this way: when the blood sugar starts rising, you have diabetes already, you know, but consistent rise in blood sugar is what is called high hyperglycemia. Then what is hypoglycemia? You have diabetes already, but before you know it, the blood sugar start going down, like 30 milligrams per year, or even 20 milligrams per year. The one we call diabetic shock. Somebody will just faint because the blood sugar has gone so low. You have diabetes, so that is going so high before.
And
Suddenly, bam, drop. That is hypoglycemia. Then we also have the third one called diabetic ketoacidosis, whereby the fat tissue, the fatty acid in your body start breaking down. You know, normally the body requires carbohydrates as fuel. That's the normal way God has made it.
Okay.
When we eat carbohydrate food, apple, rice, plantain, carbohydrate food, the body uses sugar from them.
Okay.
Produce sugar. After production of sugar, they use insulin and balance it first. But this time around, the body will use those carbohydrate food. Now start using fatty acids. Start breaking down, using fatty acid in the body as food.
As food itself.
Food itself.
To get energy.
To get energy. It's not sparing the carbohydrate or sugar that you're supposed to use. That's like it's a complication.
Wow.
Ketoacidosis, we call it diabetic ketoacidosis, and it can kill. But with diet, you can manage it.
It's okay.
And when you see those patients, they look emaciated, still looking so thin, so lean, because you don't have fat body mass again. Fat body mass is not being depleted consistently to satisfy. So that's the problem. So long term those ones as short term complication. Then going to long term complication. Long term complication means something like let us over a year or 2 or 3 or 5 years even, or even 10 years of having diabetes. What are the complications you can have? There's the one we called diabetic nephropathy.
Okay.
Diabetic nephropathy. What does it mean? Means that diabetes you have now started affecting your kidney.
Oh.
Kidney is a different organ, doing its own work. Because you have diabetes, you are not managing it very well over a long time, it now starts affecting your kidney. Especially those patients that usually eat, the usual old diet those days, the early 70s and 80s. Usually most of them have diabetes. Go and eat beans. Go and eat beans. Go and eat beans. Beans is a plant protein. If you watch the chemistry of plant protein, the way they consistent eating of beans will kill the kidney. So that's like having diabetes and having renal failure. That is what diabetic nephropathy.
Okay.
It's a complication. Then we also have another complication, we call diabetic neuropathy. Neuropathy in the sense that you have diabetes, the neurons, neurons in your body, nerves in your body is being broken down. Nerves we have in our body that our pulse goes whenever I pinch you, like you're having a feel, yeah? You're having a feel. Okay. Because your nerves are working. There's somebody that has diabetes and that such complications, you can use the pin and pinch on the person. A life person will not feel it.
Wow.
The nerves have been destroyed by sugar. Diabetic neuropathy. Also have diabetic.
What's them again?
Diabetic neuropathy.
Wow.
Nerves.
Nerves.
Okay, the third complication, there are so many complications, so just trying to see the number of them we're able to cover here. So the third one is diabetic foot ulcer.
Foot ulcer.
DFU. Diabetic foot, like your foot now.
Okay, foot ulcer.
Diabetic foot ulcer. When I agree with me that some patients will see, their leg, either their leg is being cut here, amputated here,
okay,
or their foot is being cut.
Okay.
It's a result of sugar. And the body system is made up of sugar.
Okay.
And that's affecting the nerves that control the foot. And then before you know it, you now start having like an ulcer, either in the leg or in the foot tip. That's where the ulcer comes in. So what we do now, the doctors do, once we manage with diet, we manage with the drugs, and then people that manages the foot ulcer, the plastic surgeons, they manage the ulcer, try to treat the ulcer, one other medication, diet, and so it's a complication. Somebody's leg is amputated because of diabetes. Because if it's allowed, it makes it death.
Okay.
Just that. So we also have diabetic cardiomyopathy. That is when the heart is affected. The heart is cardiac.
Diabetic cardiomyopathy.
Yes.
When the heart is affected.
Okay. Having diabetes, start affecting your heart too. So you're having diabetes, then it start affecting your heart.
Okay.
So that is that one. We have so many complications. Let me run it down again for this long time. I've mentioned diabetic nephropathy. I've mentioned diabetic neuropathy. I also mentioned the diabetic foot ulcer. Okay. I've mentioned diabetic ketoacidosis.
It's all right.
So, and of course, we've mentioned diabetic neuropathy, nerves. Okay.
Yeah. And diabetic foot ulcer.
Wow. Let us just stop it at that. But the other was with time, I explained that the time will not permit us to start looking at everything at once.
Wow. Viewers, you can see at the time I didn't know when I kind of held my hand like this because it entered my body. And coming from this, everybody needs to be careful. Diabetes is not anyone's friend.
That's all.
You need to be careful, very, very careful with what you, with all these things. So now, having discussed diabetes prevention and complications, right?
Yes.
And complications, we would like to kind of take a pause here and get prepared for what we have for you coming next, and that should be dietary management of diabetes. And that is the main topic, what we want to serve you. Now, the reason why we want to serve you this is for you to know diabetes can be controlled, and you can still take it down to a non-active stage. But the question is, are you willing to pay the price? Are you willing to do what it takes? See you in our next class. Come with your paper, come with your pen, come with everything. We're going to fill it up. I'm still your regular host, okay, Komiston Ferdinand. You're welcome.
Ooh, yeah, 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 yeah.